Hello and welcome to COVID Conversations here on WNCU 90.7 FM, streaming on YouTube, on Facebook, and I'm your host, Kimberley Pierce Cartwright. I'm the News and Public Affairs Director here at WNCU, and we're using the Zoom platform to talk about how COVID-19 is affecting our world. The U.S. Centers for Disease Control and Prevention Director, Dr. Rochelle Walensky, has recommended the vaccine for children between 5 and 11 against COVID-19, clearing the way for immediate vaccination of the youngest age group yet in the United States. And here to talk to me about parents and misinformation about COVID-19 is Syracuse professor Rebecca Ortiz. Hello, Rebecca, and thank you so much for agreeing to come on and be a guest with COVID Conversations today.
Thank you for having me.
Okay, first let's talk about what you do at university.
Sure. I'm a professor in the communications school, the Newhouse School of Public Communications, and most of my work is focused around health communications. So I'm a PhD, so I'm a thinking doctor, not necessarily like a practicing doctor. So I can't speak about the vaccine from a medical perspective, but I can speak about it in terms of how we communicate about health issues. Some of my research that I think is most relevant to the discussion around the COVID vaccine is some work I've done on the HPV vaccine, which, if anyone's unfamiliar, your listeners are unfamiliar, is a vaccine available for human papillomaviruses, which is a sexually transmitted infection or sexually transmitted infections. And what happened is that vaccine used to be kind of new, very similarly to how the COVID vaccine is new. And it's available, recommended for children ages 10 to 11. And so I did a lot of research talking to parents, talking to kids about their perceptions of the vaccine. And what I'm finding is that some of the results that I learned from the HPV vaccine might be very applicable to how we communicate and think about the COVID vaccine now.
So let's do a little bit deeper dive into that. What were like the responses from parents? Were it almost the same, the same? How were people feeling? And then how was information relayed to them to calm their fears about it? Because we're talking about kids who aren't really sexually active yet.
Right. I'm glad you bring that up. And actually, so one of the things as researchers we thought was going to be one of the biggest barriers to parents getting their children vaccinated was the fact that it was for a sexually transmitted infection. We were worried that parents would be saying, well, my child's not sexually active yet, so why would they get this vaccine? Something sort of similar with COVID is this idea, well, children aren't really affected by COVID, so why would I get them this vaccine? And the reality is that while there were negative perceptions or there were concerns about safety and efficacy and side effects of the HPV vaccine, just like we're seeing with the COVID vaccine, the number one biggest predictor of whether parents actually got their children vaccinated was whether their doctor recommended it. And what was really surprising is that a lot of doctors were not recommending it because there's a variety of reasons, but one of the reasons was because the doctors thought that parents didn't want to have their kids vaccinated or had all these misperceptions. And so there was this miscommunication between patient and provider. And so we learned that if we armed the doctors and the pediatricians with better language and better skills and tips to communicate with their patients, parents were more willing to get their children vaccinated.
Well, that seems like such a disconnect to me, because going to the doctor, in my opinion, is just so personal. So informing doctors. So did that work when you were doing your research and talking about the HPV prevention? Well,
my research is one tiny slice of the pie. There's a ton of research around there about the HPV vaccine. And so there's a lot of research that has shown that this consistent finding that if doctors recommend it, parents are way more likely to get it for their children. And you point out a really good point, which it is a very personal moment. So we've been talking a lot about, well, how do we communicate to parents about this vaccine, the COVID vaccine, and try to lessen their fears or their concerns? And there's a lot of talk about politicians getting on or celebrities saying things or these big mass media campaigns, but those aren't personal, right? Those aren't really necessarily addressing one-on-one the concerns that a parent might have. So when a parent can come into the doctor's office and communicate one-on-one their personal concerns, and the doctor is prepared with language about how to lessen those concerns, that's going to be more powerful. And so I think you're absolutely right. It is more personal, and that's what makes it more effective.
So can we talk about maybe some of the language that you and your research have encountered that would cause a negative effect with people not getting the virus?
That's a good way to think of. So what is language that might make people more fearful about the vaccine? Is that kind of what you're thinking?
Yes.
We find if there's a lot of focus on the negative, right? So one of the things we were worried about with the HPV vaccine, and is very similar in this instance with the COVID vaccine, is there's a lot of concerns around side effects. So will this vaccine have side effects? Will it have long-term side effects? Is really the big one, I think, especially for parents with their children, because their children are still very young. And so when you focus the messages on those negative things and trying to correct those misperceptions, you're actually spending more time focusing on the negative. What I have found to be more powerful in encouraging people to get vaccinated is focus on the positive. So instead of trying to constantly correct those negative perceptions, focus on the positive outcomes of getting this vaccine. We found that to be the most powerful messaging that would encourage students. So when a doctor says this is something that can, or even a mass media campaign talks about what are the positive things that can come out of doing this behavior, it can be more powerful than trying to correct the negative things that they might be concerned about.
That's so interesting, especially about the weight of it, going back and trying to create a positive on top of a negative rather than going forth with a positive. I never really thought about it that way, but I was thinking more echo chamber. Would that apply if you send out more positive, then and it'll come back positive?
That's a great question. And I think we have to think about, even to your point there, is weighing the negative against the positive. Negative is always going to be more powerful. Think about the last time that someone gave you a compliment versus the time someone said something negative or rude to you. You remember the rude negative things, right? You don't necessarily always remember the positive, at least not as powerfully. And so to miscorrect, arguably, the negative information out there, we need to put more positive information, because the negative is more powerful on its own. So if we can put more positive and really focus on what can this vaccine do versus what are we worried it's going to do negatively, we can focus more on the positive. But we do have to remember that negative is going to be more powerful. So that's why we have to put more positive messaging out there.
So, wow. So who will bring the message? So, and then I'm really interested in who will bring the message to the doctors. And then will the doctors have like negative responses about, well, I'm the doctor and I should be in charge of this?
You ask excellent questions. And unfortunately, they're not easily answered, but I can give you sort of some of my thoughts on them. One of the things that we struggle in doing work like this, to try to get information to providers to be able to do exactly what I'm saying, be able to have these conversations, is where do you do that? Because we don't have a centralized healthcare system, right? We're disjointed. We have all people in different networks and different things. So it's actually a really difficult thing. There's a lot of different strategies you can take. Like you can look at larger sort of healthcare organizations and try to provide messaging through that. But it's not an easy task. So the thing we need to do is actually the most difficult thing to do, because our providers are so disjointed. So part of the messaging strategy might be to actually push out a lot of these messages on a mass level to try to reach doctors with those messages. Though we would prefer to be able to reach them directly, we just don't have a centralized system to do that in a way that would be most effective, unfortunately.
So as someone who's studying this, are you anxious about this, or are you just really at your wit's end about where that source of information would come? How is it that you as a professional are seeing it personally and having an emotional investment in what's happening?
It is tough, because I am of the belief that we should all be capable of making our own healthcare decisions, that we should be given information that can allow us to make those healthcare decisions. And of course, there's a lot of information out there that isn't medically accurate, that is confusing. And I think one of the things that we need to understand is that we're talking, specifically when we're talking about getting children vaccinated, we're talking about something that's going to be a very emotional response for parents. So I don't think many of us are going to argue the goal of parents is to protect their children, and often at the expense of their own health, right? We see mothers and fathers often being, putting their child's health before their own. So we have something where there's an emotional response. And so any sort of negative information out there could really impact the decisions that parents make. So I don't blame or shame parents for being concerned or having fears about, well, what are the long-term side effects of this? But because really what they're trying to do is protect their child. What I hope, though, is that parents will generally be able to understand that the positive outcomes of this are greater than those negative. But I do respect the need for every parent to make the decision for themselves. And so I hope that parents will feel empowered, if they're not already, to speak with their healthcare providers. And what's great about this is that children often have routine visits, right? They go and get their doctor visits like once a year. Plenty of adults definitely don't go and get annual visits or get themselves checked in. We know men in particular are less likely to visit their healthcare providers than women. So we have a great opportunity with children, is that there's already this sort of systematic routine check-in with doctors. So hopefully parents will be willing, and hopefully the doctors will be willing to have these conversations.
Talk to me about like the trajectory, I guess, of your research. So when do you come to the end of what you're looking at and looking for, or do you feel that it'll continue into infinitum because we don't know when COVID is going to be over?
Yeah, you're almost asking sort of an existential question, like, when does this end, right? Like, and especially in terms of research, when does this end? I don't know. COVID obviously has lasted much longer than we expected. And we know that the issue of misinformation is not going anywhere. If anything, it's amplifying. The more that we are connected online and have different ways to connect, the more voices that are involved. So in terms of my research, it is never ending. I mean, it ends when I end, really, because there's always something to look into. And there's always entities trying to spread information that is inaccurate. So I think what we can do is we can continue to understand, well, how do we counter that? And my goal is really to try to put more of a positive perspective out there than a negative. So I don't know when this ends, but I'm definitely not done anytime soon.
So I want you to reiterate. So we know that there are people out there that are going to get the vaccine or have already gotten the vaccine and they're done.
Right.
Get their boosters. And then there are people who are on the fence and they're hesitant. And I'm like, I don't know what I'm going to do. And then there are definitely people who will never get the vaccine, and their children will never get the vaccine either. So can you reiterate like what it is that you're trying to communicate?
Yeah.
People, having their children between 5 and 11 vaccinated.
Yeah, I love that you did that, because those three groups are the exact groups that we look at when we look at vaccination. And how do we communicate? So the people who are already vaccinated, like they've already signed up, right, for their children to be vaccinated. We don't have to speak to them. They're good. And what I argue is really all you have to do is give them the information where to go. Then you have the people on the other end who unfortunately, if you look at it and you feel really strong about vaccination, unfortunately, it might be people you can never convince, that there will never be enough information. You will, in some case, waste your time trying to convince those people. Who we really want to focus are those fence sitters, those people who just need to be able to have a conversation about their concerns. I think a lot of the communication we've been having in the media, discussion, is this sort of shaming of people who have questions and who are wanting to make the best decision. And so I think if we give, or I shouldn't say I know that if we give these people spaces to be able to communicate that and be there with the right answers, or the answers that we feel are as close to medically accurate as we have at this point, we can communicate and alleviate some of those concerns. But for some people, it's going to take a while. And that's not an answer that a lot of people want to hear, but we have to respect that parents are trying to do the best for their children, and try to arm the providers with as much information and assistance in how they communicate. Though, as we've acknowledged, that's an easier said than done thing.
So one more thing, what about a good clearinghouse that you think that people could get information about these vaccinations?
No, it's funny because when I think about places to go for information, my response is the CDC, because it is the place where you will find the most up-to-date, most confirmed in terms of what everybody else is using to make decisions about. I know for some people, though, that becomes kind of a political issue where they may not feel confident in the current administration, and therefore they don't feel confident in public health agencies. But it really is, the CDC isn't a partisan place. It's a place that's meant to be focused on public health. So it really is the best place to go to get your questions answered. And I hope people can kind of understand that, yes, you might feel some certain way about the organization because of the way that they've communicated or because of whatever partisan connections you might associate it with, but it really is the best place. It has the most comprehensive information and should be able to answer every question that you have.
Oh, thank you so much. Our time is up, but I really do appreciate your coming in to try to help us navigate our way through information and misinformation about kids between 5 and 11 vaccinated. Thank you so much for your time.
Thank you so much for having me. I appreciate it.
Yes, and we've been talking to Rebecca Ortiz, and she is a Syracuse University assistant professor who has a wealth of knowledge about all of this stuff. So we thank you very much, audience, for listening. We thank you so much for watching us on YouTube and on Facebook, on Instagram, as well as listening to WNCU. Be sure to like us. We want you to follow us and subscribe to our pages to see more of our archived shows. I'm Kimberley Pierce Cartwright, your host for COVID Conversations, and I'll see you next time.